as an affliction to 4 million people in the United States and the fifth leading cause of disability worldwide. Bipolar disorder is the result of a complex group of genetic, psychological, and environmental vulnerabilities. People can sometimes mistake the symptoms of bipolar disorder for some other kinds of mental health disorders, such as depression. Having said that, this video presents bipolar disorder. All you need to know. Definition of bipolar disorder. Formerly known as manic depression, bipolar disorder is a mental illness marked by extreme shifts in mood. It is characterized by an extremely elevated mood called mania and may include repeated episodes of depression. Manic indicates the periods of overly excited and energized feeling, while depression describes the periods of very sad or depressed feeling. In other words, people suffering from bipolar disorder switch continuously from high to low mood. Types of bipolar disorder. Bipolar disorder has several types, including Bipolar I, Bipolar II disorder, Cyclothymic disorder or cyclothymia, mixed features and rapid cycling. Bipolar I disorder is diagnosed if the individual has at least one manic episode lasting more than 1 week, but does not require a history of major depression. Bipolar II disorder occurs when the person has experienced at least one episode of major depression and at least one episode of hypomania, a milder form of mania. Cyclothymic disorder means the patient has regular episodes of hypomania and depression for at least 2 years. Mixed features occur when the person experiences symptoms of mania and depression at the same time. Rapid cycling is diagnosed if the person has 4 or more depressive, manic, mixed or hypomanic episodes in 12 months. For every type and duration of the illness, the sufferer will have trouble in his or her functioning at school, at work, socially or in their community. Symptoms of bipolar disorder. 3 main symptoms can happen to people with bipolar disorder are mania, hypomania, and depression. During mania episode, a person may experience overexcitement, happiness, and hopefulness, increased energy and less need for sleep, restlessness, high sex drive, increased impulsivity, drug and alcohol abuse, rapid speech and poor concentration, a tendency to make grand and unattainable plans, a tendency to show poor judgment, such as deciding to quit a job. Generally, hypomania is related to bipolar II disorder. During hypomania episode, the person may not have any serious trouble at work, school, or in social relationships, except for some changes in their mood. During an episode of depression, the person may experience deep sadness, loss of energy, periods of too little or too much sleep, a change in appetite causing weight loss or gain, feelings of hopelessness or worthlessness, difficulty concentrating, difficulty making decisions, uncontrollable crying, lack of interest in activities they once enjoyed, thoughts of death or suicide, attempting suicide. People prone to bipolar disorder. Over 2 million adults are suffering from bipolar disorder in America, according to the National Institute of Mental Health. A majority of adults before the age of 35 develop this condition, however, its severe forms also appear in children and teenagers, and often in combination with attention deficit hyperactivity disorder, ADHD. Among all people having bipolar disorder, approximately 60% depend on drugs or alcohol. People with seasonal depression and certain anxiety disorders, like post-traumatic stress disorder, PTSD, have also been shown to be more likely to get bipolar disorder. Men and women have an equal likelihood to get bipolar disorder, however, more rapid cycling seems to be seen in women. Also, women are likely to have more depressive episodes than men. Causes of bipolar disorder. Bipolar disorder does not seem to have a single cause, so it is quite difficult to identify exactly what causes this condition. However, it can include genetic factors. A person who has a family member with the condition is more apt to have the disease. Changes in the brain. It appears that neurotransmitter imbalances play a key role in many mood disorders, including bipolar disorder. Environmental factors. Mental stress, a significant loss, or some other traumatic events may contribute to or trigger bipolar disorder. Treatments for bipolar disorder. The main aim of treatment is to minimize the frequency of mood changes as well as to reduce the severity of symptoms so that the patient can have a relatively normal life. Regarding drug treatment, lithium carbonate is the most commonly prescribed long-term drug to treat long-term episodes of depression and mania or hypomania. Other medications include anticonvulsants for mania and antipsychotics, treating very disturbing behavior and severe symptoms. Medication may need to be adjusted as moods shift accordingly the doctor's instruction, and some drugs have side effects. Besides medications, bipolar disorder may be managed in combination with psychotherapy or talk therapy to prevent future episodes. Psychotherapy aims to alleviate and help the patient manage symptoms. What other diseases do you want us to make videos about? Tell us in the comments section below. Thanks for watching.